Alport syndrome is a rare genetic disorder. It primarily affects the kidneys. This happens because of a mutation in genes responsible for collagen production. Collagen is a protein. It acts like a scaffold. It provides structure and strength to tissues throughout the body. In Alport syndrome, the mutated genes disrupt the production of type 4 collagen. This type of collagen is essential for the proper functioning of the kidneys, ears, and eyes. The absence or abnormality of type 4 collagen weakens the tiny blood vessels in these organs. This leads to a range of symptoms and complications. Alport syndrome can manifest differently in individuals, even within the same family. Some individuals may experience mild symptoms. Others might develop severe kidney disease. Early diagnosis and treatment are crucial. This can help manage symptoms. It can also slow down the progression of the disease. This ensures a better quality of life for individuals with Alport syndrome. The kidneys play a critical role in the body. They filter waste products from the blood. They also help regulate blood pressure and electrolyte balance. In Alport syndrome, the abnormal collagen affects the filtering units of the kidneys, called glomeruli. Glomeruli are tiny blood vessels. They act like sieves. They remove waste products from the blood to make urine. The damaged glomeruli in Alport syndrome cannot filter blood effectively. This leads to the leakage of blood and protein into the urine, a condition known as hematuria and proteinuria. Over time, this damage can lead to scarring and inflammation of the kidneys. It reduces their ability to function properly. As kidney function declines, waste products build up in the blood. This can lead to a range of complications, including high blood pressure, anemia, and swelling in the legs and ankles. In severe cases, Alport syndrome can progress to end-stage renal disease, or ESRD. This requires dialysis or a kidney transplant. Hearing loss is a common symptom of Alport syndrome. This is due to the abnormal collagen affecting the delicate structures within the inner ear. The inner ear contains the cochlea. The cochlea is a spiral-shaped organ filled with fluid and hair cells. These hair cells are responsible for converting sound vibrations into electrical signals. These signals travel to the brain, where they are interpreted as sound. In Alport syndrome, the abnormal collagen weakens the blood vessels that supply the cochlea. It also affects the structure of the hair cells. This damage can lead to progressive hearing loss. Hearing loss in Alport syndrome typically begins in childhood or adolescence. It often starts with difficulty hearing high-pitched sounds. As the condition progresses, it can affect a wider range of frequencies. This can make it challenging to understand speech and other sounds. While kidney disease and hearing loss are the most common manifestations of Alport syndrome, vision problems can also occur. These ocular abnormalities are less common than kidney and hearing issues. They can significantly impact an individual's quality of life. One of the most common eye problems associated with Alport syndrome is anterior lenticonus. This condition affects the lens of the eye. The lens is a transparent structure that helps focus light onto the retina. In anterior lenticonus, the lens develops a cone-shaped bulge. This can distort vision. It can make it difficult to see clearly. Another eye problem that can occur is dot and fleck retinopathy. This condition affects the retina, the light-sensitive layer at the back of the eye. In dot and fleck retinopathy, small yellowish spots appear on the retina. This can cause blurry vision or blind spots. Section 5. The genetics of Alport syndrome. Alport syndrome is a genetic disorder caused by mutations in genes. These mutations are passed down from parents to their children. The most common type is X-linked inheritance. This means the mutated gene is located on the X chromosome. Males are more severely affected than females. Other types are autosomal recessive and autosomal dominant. Recognizing the symptoms of Alport syndrome. Symptoms vary widely depending on the gene mutation and overall health. Early recognition is crucial for timely diagnosis and management. Hematuria, or blood in the urine, is a common symptom. It can be detected through a simple urine test. Hearing loss is another hallmark symptom. Vision problems can also occur, but may develop later in life. Section 7. Diagnosing Alport syndrome. Diagnosing Alport syndrome involves a comprehensive evaluation of the individual's medical history, physical examination, and laboratory tests. The doctor will ask about any family history of kidney disease, hearing loss, or vision problems. A urinalysis is a common test used to diagnose Alport syndrome. This test checks for the presence of blood and protein in the urine. A kidney biopsy may be performed to confirm the diagnosis. This involves removing a small sample of kidney tissue. It is then examined under a microscope for signs of glomerular damage. Genetic testing can be used to identify the specific gene mutation responsible for Alport syndrome. This can help determine the inheritance pattern. It can also assess the risk of passing the disorder to future generations. Genetic counseling is recommended for individuals with Alport syndrome and their families. Section 8. Treatment and management of Alport syndrome. There is no cure for Alport syndrome. Treatment focuses on managing symptoms. It slows down the progression of the disease. Early detection and intervention are crucial for improving long-term outcomes. Kidney management is a cornerstone of Alport syndrome treatment. Medications, such as angiotensin-converting enzyme, ACE, inhibitors, or angiotensin receptor blockers, ARBs, are often prescribed to lower blood pressure. These medications also help reduce protein in the urine. They can slow down kidney damage. In some cases, individuals with Alport syndrome may eventually require dialysis or a kidney transplant. Hearing loss associated with Alport syndrome can be managed with hearing aids or cochlear implants. Regular hearing tests are essential for monitoring hearing loss progression. Prompt intervention can help individuals maintain their ability to communicate effectively. Section 9. Living well with Alport syndrome. Living with Alport syndrome requires a multifaceted approach that encompasses medical management, lifestyle modifications, and emotional support. Regular monitoring is vital for individuals with Alport syndrome. This includes regular visits to the doctor, kidney function tests, urinalysis, blood pressure checks, and hearing tests. These monitoring measures help detect any changes in the condition and allow for timely adjustments to the treatment plan. Adopting a healthy lifestyle can significantly impact the progression of Alport syndrome. This includes following a balanced diet, low in sodium, phosphorus, and protein. It's also important to engage in regular exercise, maintain a healthy weight, and avoid smoking. Genetic counseling can provide individuals with Alport syndrome and their families with a better understanding of the disorder. It can also help them make informed decisions about family planning. Section 10. Conclusion. The importance of awareness and early intervention. Alport syndrome is a rare genetic disorder that primarily affects the kidneys, ears, and eyes. Mutations in genes responsible for collagen production lead to the weakening and damage of blood vessels in these organs. This results in a range of symptoms, from blood and protein in the urine to hearing loss and vision impairment. Early detection and intervention are paramount for improving the lives of individuals with Alport syndrome. By raising awareness about this condition, we can empower individuals and families to seek timely medical attention. Through ongoing research and advancements in treatment, we can strive to improve the long-term outcomes for those living with Alport syndrome. Collaboration between healthcare professionals, researchers, and patient advocacy groups is essential for driving progress in the field and providing the best possible care for individuals with Alport syndrome.